Which of the following is most likely route through which the infection reached the patient's lung? 35-year-old woman presents to the ED with high fever, productive cough, pleuritic chest pain for the past week. She recently had a dental procedure 2 weeks ago. The chest x-ray shows cavitary lesion in the right lower lobe. Blood cultures are positive for Streptococcus intermedius, which the following is most likely route through which the infection reached the patient's lung. Hmm. Streptococcus intermedius. I'm guessing that's a gram positive. Dental procedure 2 weeks ago.
I think you're on the
Yeah, to
right.
reach the lung, maybe aspiration. Homogeneous, like I was thinking initially, hematogenous spread. That doesn't make too much sense. Um, direct extension from a nearby infection. I don't see too much information for that. It's also right lower lobe. That also makes sense for aspiration. Aerosolized particle. I don't know if Streptococcus can be aerosolized. I'm usually thinking viruses with that. Traumatic inoculation's always okay, but I'm thinking with that more of like a Staph aureus, something that's like on the skin. So yeah, I'd go with aspiration.
Yeah, it's going to be
Ooh, okay.
hematologous. Okay, the reason
Okay.
why is I'll talk to you why here. So,
It's
recently,
like same as like the dental and heart issue with
yeah, it's the same exact way,
okay.
right? And just remember, they're not going to give you a history of dental procedure unless that ties into kind of what's going on.
Okay.
Okay. So, for instance, your answer aspiration would make sense if they give you a history of like alcohol or somebody who will have increased risk of aspiration, like dementia, alcohol users, opioid abusers, things like that,
Sure.
that people like don't have control, right? And they'll aspirate. Um, and that can also be oral flora or anaerobes in your mouth, right? But in
Yep.
particular, they told you that they had a dental procedure, right? And then it came back as some kind of oral flora, dental flora, right? Meaning that you do the dental procedure, it seeds into the bloodstream, and then it somehow lodges and gives you a lung infection. So it's going to be hematogenous here.
So so that would be like the same for like strep viridans, right? Or something
Yeah,
when you have
same thing. Yeah, same
so
exact.
that would also be hematogenous, like
Yeah, that's
spread
going to be
that way.
hematology. Yep.
Okay.
Because it wouldn't make any sense for any other pathway, right? It can't be direct extension. It's way too far. Mouth to heart or mouth to lung, right?
Right.
That doesn't make sense, right? Inhalation of aerosolized particles. I mean, these bacteria are not really aerosolized, right?
Right.
Traumatic inoculation. I mean, I'm not sure what that even means, right? Induction through a body through a break of skin and mucous barriers, a punctual or surgical incision. Unlikely, right? Yeah, so the best is it kind of just seeds off kind of the teeth, gets into the bloodstream, and then kind of traverses there. So
Okay.